I think I saw a video
So,
of
oh,
the moment he escaped and he looked a bit sheepishly around the corner and went between two brick walls and just
yeah,
kind of spanned his
yeah.
way up.
Yeah, crab
Yep.
walked or spider walked his way up, and supposedly back in May, a previous person had done the same thing, but he hadn't gotten very far, and they
Mm.
brought in a bunch of consultants to add some additional countermeasures, barbed wire, full-time visuals on the prison tower, everything
Gosh.
like that. And yet this guy, he was a person who was capable and fit to get out of there. He certainly managed to do it.
Those consultants didn't do their job, or maybe they did, Jamie, and the users didn't adopt the things that they implemented for keeping
Exactly.
prisoners.
See,
So,
there's a lot of
yeah.
times that the consultants put out the right work to do, and it's really up to the clients as to whether or not they're ultimately going to adopt the suggestions and everything.
That is a beautiful segue. Welcome to the i-Pharm GxPodcast, your go-to source for insights and discussions on all things GxP in the life sciences industry.
Join us as we dive into the realms of cutting-edge advancements, explore groundbreaking ideas, and meet the thought leaders and visionaries who are shaping this space.
Each month, we'll bring you engaging conversations, expert interviews, and thought-provoking stories. We're happy to have you here.
Hello, everyone. Welcome to the GxPodcast. Today, we're here with Jamie Leary, a man who has 16 plus years in the pharmaceutical industry and has spent an equal amount of his time in manufacturing, technical operations, and quality roles. He's worked across the fields of biologics, vaccines, small molecules, OTC, immunotherapies, including both CAR-T and viral vectors. He's a sterile and aseptic manufacturing and process SME and has worked in early stage development all the way through commercialized products. He has extensive experience leading teams as the project manager on hypercare initiatives, remediation initiatives, tech transfers, facility startup, and operational readiness. Jamie, great to have you with us.
Thank you, Phil, and thank you, Max, for having me. It's a pleasure to be here.
Very happy to have you here. Thank you for the time.
All right, Jamie, I'll go right into the questions here. We're here to talk about Pharma 4.0 and the push for paperless. This is going to be overlapping and focused through your perspective and some of the things you've seen in the industry over your decade and a half plus. So I guess initially here, how do you see the Pharma 4.0 initiative and digital transformation shaping the future of the pharmaceutical industry, particularly in terms of the efficiency and compliance within life sciences?
Sure. So certainly with Pharma 4.0 and the idea of the paperless part of the initiative, big data-driven analytics, using that to drive some AI type artificial intelligence and using that to ultimately make a more lean and efficient end-to-end process within the pharmaceutical industry. Everything from the supply chain through manufacturing, the quality and compliance side with data integrity driven through the agency's initiatives, and ultimately a more efficient, more effective, and better product for the end client. So that's how I see the drive of Pharma 4.0, and certainly looking at the quality and compliance side of it and being able to look at the data integrity and how that relates to the people part within the manufacturing process.
Fantastic. And I think it might be worth us looking to just quickly define what Pharma 4.0 is. I'm sure there's a lot of buzzwords and terminology that we'll use that we probably know as second nature, but I think it's definitely worth us having a look into what that means overarchingly. And obviously we can tie that back into what you've covered. There's a lot of exciting technology coming through globally across all industries, and certainly they're going to have a major impact on the industry we focus in, from pharma, biotech, and med device. So yeah, give us an overview of what Pharma 4.0 is.
Sure. So again, it was an initiative laid out in Germany in 2010, 2011, and then recoined by the ISPE around 2017, looking to move more towards the digital transformation. And as we had mentioned before, the idea of going instead of paper-based to paperless type processes, end to end, of course, using data, big data, using analytical sources, artificial intelligence, machine learning, and really, projecting the pharmaceutical industry into the 21st century with data driven results. So that's really, again, moving away from the paper based process of the previous century and into the 21st century.
So you're telling me that writing everything down on paper isn't the most effective way of running a global pharmaceutical organization?
We want to adapt, change, and move forward with the latest and greatest technology while staying compliant. Yes.
Absolutely. I think that's smart. And I guess in terms of, you mentioned a couple of areas there, but how would you see and how can pharmaceutical and biotech companies leverage digital transformation to improve collaboration and communication amongst different teams involved, let's say, in a manufacturing process?
Great question, Max, and thanks for that. Certainly, one area of focus that we would look to is the automation side of that, where different key processes that maybe had been very human and labor intensive manual processes in the past are coming into the digital age, whether it be through SCADA systems using QR codes moving through the different parts of the process when you're pulling supplies off shelf using the QR code instead of manually writing down the lot and stock numbers of those components. We're using temp tails as we're looking at real time material transfer, such as different viral vectors and such. We can watch real time what that temperature is as that material moves, if it's not within the facility, across the country or globally. Same thing with end product. So, just again, a real time view of what's happening with your end to end business and your process. Now, again, to go back a little bit, we talked specifically about the manufacturing side of process. So you have your OEE, your overall equipment efficiency, that will allow shift to shift ability to put up dashboards, see how the actual manufacturing process is going. Are you on time? Are you behind? Are you ahead of schedule in terms of your manufacturing process? And that will allow your planners to help forecast those lots getting ready to go out the door. It will allow for your just in time process of ordering more materials in. It will allow your on the floor production managers, supervisors, as well as their direct leaders to see if they need to adjust the scheduling of manufacturing processes that don't necessarily stay to a fixed schedule. They may vary here and there with line downtimes or processing downtimes. So there's a lot of great opportunities. Plus, ultimately, getting back to the idea of data analytics, the ability to take that information time over time, week after week, month after month, and use that for long term planning and forecasting. Again, looking at how your equipment is efficiently working as well as your process in general, your manufacturing process.
Jamie, I love that. And you mentioned a couple of things that I think overlap here. And we're using the terms push for paperless and Pharma 4.0 almost interchangeably. They are related but separate initiatives. And the things you talked about, like data driven analytics, manufacturing efficiencies, and how that helps you stay competitive and also compliant. It seems like there's a lot of data moving around. Could you explain a little more about the data integrity and how it ties all those things together and how you might have struggles and successes with that as you implement these new technologies in real time?
Sure, of course. So again, you're absolutely right. When you have pen to paper, there's a benefit of that because you can actually see it on paper. Whereas if you're doing all these digital data transfers goes out into the ether world, if you will. So you want to stay compliant on your data transfer, your data process. And again, that's where you start looking at your validated systems, your automation, going through your CQV process of your qualification, compliance, and validation side of things as you have to look at, for instance, the agency through data integrity is looking for single ID users. So you're not going to log on to an HMI with just an HMI logon of each individual person's going to be logged in and logged out. Same thing in the QC labs when you're running your QC testing on your various pieces of equipment. And that also brings up, to your point, with some of the older legacy equipment, you may have to update the software, you may have to update to newer versions of pieces of equipment. The test may be similar to what was run in the 80s, 90s, and early 2000, but those pieces of equipment may not be able to sustain the newer software or the demand of the agency in terms of data integrity to have multi-user logons, independent logons, stuff like that. So there's a component of continually upgrading, just like you're working for efficiency within your manufacturing process. Over time, you're still also going to have to update some of your legacy equipment in order to stay compliant within the industry, especially related to data integrity.
Makes a lot of sense. And then out of curiosity, I know a lot of the benefit that's going to come from leveraging these digitized tools and moving away from paper-based systems is continuity and instantaneous access to what is the most up-to-date SOP or the most up-to-date process or way of working to make sure that there is harmonization globally in the global world we live in, and these companies that are out there that have sites all across the world and supply chains that are disparate across different continents. So, I guess how can digital technologies help standardize various workflows and enforce SOPs in the industry? And what are the associated benefits of that within that use case?
Sure, absolutely, Max. And I think you really hit the nail on the head with that, is the real time compliance, if you will. So in the past, where you would have had to print out an SOP to go into a manufacturing area, now you could use something similar to a tough book or some sort of smaller tablet, if you will, for having an up-to-date process in place, including if a user's not currently trained on something, them not being able to either access the HMIs or the processing materials, or even be able to ultimately log into that electronic batch record to do the step. And that would help to prevent a training non-compliance of that individual not being trained on a certain SOP or work instruction. But also it would allow, for instance, hyperlinks or videos that had been created of the process in the past for training experiences, opportunities for technicians and users. If, for instance, they wanted to revisit a process steps, work instructions in the past, they would have had to read and follow a diagram or a chart or some pictures of how that process is done. And now you could have a hyperlink. You could have that same, to your point, if it's globally, you could have the same process translated into whatever language was needed for it to be done. It would be the same process, but again, an understanding within the localized language, the ability for everyone to be on the same page, if you will, in terms of how that manufacturing process happens. And again, we look back at what the agency globally are looking at, which is staying compliant and manufacturing within a confine of being able to do it in a regulated way, a way that allows you to not deviate from that process. And I think that electronic batch records also help within that.
And to your point on the training aspect, there are a couple of companies that I've been speaking with recently who, in an additional kind of step to what we're discussing on just getting everything standardized in a paperless system, are leveraging technologies like augmented reality, and they're investing pretty heavily in. For example, what you just saying, you could put an augmented reality headset on, be in a lab, and you can have the SOP, the instructions up on the side of your screen here that you can see floating there. You could have a trainer or someone within the management of the organization in a video call floating there as well. And they can see exactly what you're doing, hands-on, making sure that you're following the SOP in the most accurate way possible, providing real-time feedback, and then that getting fed back into the online resources for everyone to see and say, hey, this is an example of someone doing something right. This is an example of someone doing something wrong. And I think it's really exciting technology that we're going to see adoption in. Have you come across any businesses that you've supported to date who have been having conversations about leveraging that type of technology, and or have you have had any experience with it yourself?
So, very good question, Max. So, I have worked with some organizations that are looking into it. I too find it very fascinating, especially some of my experience previously doing aseptic fill finish, where we would do what they would call water runs. So, it was basically you would run water through the fillers and that whole process, and you would use that in order to qualify the folks who had not had their gowning before you put them into an actual aseptic filling environment. So they would fill water, they would use it as test runs on the equipment. Maybe they were using it as part of the process or just equipment shakedowns. But that wouldn't happen all the time. It wasn't, they'd have to schedule it maybe a few weeks out. They'd also have to get enough people together. They'd have to get line time in order to do that. So moving towards the idea of the virtuality or the augmented reality of literally letting a classroom or a few people doing it with a trainer one-on-one, hands-on, it gives them another idea and also real-time correction on how to move through that aseptic process, what to do and what not to do. It just, again, flexibility. There's certainly both a time and a capital commitment
Mhm.
for that, but I really do see where organizations are really wanting to, they believe in the people, right? So you need the people in the process. And again, I believe the organizations that are out there are looking at that as a great, another training opportunity, another opportunity to help their technicians, to help their team members get a leg up, if you will, ultimately to become more efficient, because that's what it's about. It's about getting the needed medicines out to the patient in all the processes. So any way that they can speed that up, make it more efficient, keep it compliant, that's what they're looking to do.
Jamie and Max, you guys talked about a really cool example of how that digital and almost space age technology, sci fi futuristic stuff of VR can help in identifying and training people up to avoid problems. Are there any other areas, Jamie, specifically where that digital transformation could help either identify or improve processes in pharmaceutical manufacturing outside of that training aspect?
I think again, just within the automation side of things, as you move through continually automating and updating the processes, leaving less chance to potential for human error. We did talk about electronic batch records and MES. If we jump back to the virtual or augmented reality, not just in the training of people in a filling scenario, but also connections. You can do aseptic connection processes. You can do virtual, how to, if you don't have a space, say you're manufacturing in a ballroom with a bunch of different processes going on, but your staff isn't trained up to go in there, you could set up an augmented reality process to go in and show them how to literally click on the HMI on the side of a sub or something like that, a tank. So I think there's lots of opportunities where really the imagination is the only limiting factor of you could get to the point where it's so real that you literally have a mock-up of your facility, and you can allow the people to go through the sub that I mentioned before. Again, the single-use bioreactors, how to place the bags in those bioreactors, how to set the mixing speeds, what training you do to monitor that. And you can actually build scenarios into place of, if folks aren't watching, if the temperature either goes up too high or doesn't go up high enough, you can have them where they have to open the valves to the glycol line. There's, again, it's only limited by one, the time, two, the money, and three, the ultimately, which is the imagination. But I think you could set, it would work really interesting interestingly, for a tech transfer. We
Mm.
currently, for tech transfer, potentially you would have to see it, especially as we talked about varying stages of the process and moving to your CMOs or CDMOs,
Yep.
your contracting facilities, or even tech transfer within your own organization, moving it from the bench and the early stage development into the actual manufacturing site. If you could do it virtually and show a process flow or process walk down, again, I think nothing beats hands on, but if you could give
Hmm.
an updated process, it just helps. It helps the technicians, it helps the managers and supervisors know what's coming and ultimately plan for the future.
Absolutely. Anyway, in my viewpoint, any way that we can leverage and implement technology is a smart thing to do. It's always going to optimize for efficiency and visibility and compliance and a range of things. There are certainly people who are pro technology, certain people who are against it, and a lot of people who fall within the middle. And it's always important to have those early adopters in your organization who are going to try and push that. It's hard to make transformation within large organizations, but about having people who can really show the use case and the benefit of implementing this stuff, not only to the buy-in of everyone involved, overall compliance, and ultimately quality of the product that is getting to the patients, which is at the end of the day the most important thing. I think it's a very important thing for people to be aware of, for people to be forward thinking about, because often a new technology comes, people kind of delay implementing it, and then 5 years later the companies who have implemented it are absolutely flying, and those who delayed on it are going to be
Sure.
struggling. And I guess in terms of your experience and the companies that you've supported, give us some examples outside of the VR/AR training piece that we've discussed that you've seen a successful digital transformation within, and how it's been successfully implemented, and overall what the impact has been on that business after the fact.
Sure. So some of the areas of experience and opportunity that I've seen are companies moving more towards a, shall we say, cloud-based system for capturing their data.
Hmm.
And it's really not only their own interest in moving it forward, but also certain agencies pushes to, as you mentioned before, want to be able to put that information back out there in a timely and an expedient manner. Upper level management wanting real time visibility to manufacturing and how things are going globally, if you will, not just within the plant site. And for instance, one of those experiences would be, again, the updating in terms of data integrity, updating the software on QC lab items, different types
Mm.
of testing, if you will, being able to know who ran the test, when they ran the test, how frequently they ran the test, and instead of that being captured either in a notebook, lab notebook within the lab, or filed somewhere in a filing cabinet, the ability to have that information linked to a digital platform, a SCADA, if you will, that a lab manager could watch or lab supervisor could see in order to be able to schedule out additional testing or know, especially in a contract manufacturing environment, the ability, because the timing and the space is limited. And I think
Mhm.
it also helps too that not only are you looking at it for that point of view, but again, from an efficiency standpoint, if you only have one piece of equipment, a certain type of pipetter or something that is automated and it takes a certain amount of time to run a test, if that piece of equipment is utilized basically all shift every day and it's back to back tests, do you need to buy a second piece of equipment? Do you need to bring on additional
Mm.
staff? So there's always that business need, but it also helps on the non-compliance, non-conformance side of deviations, if you will. Performance, for instance, if you ran a lab test and the results did not come out to be what they were supposed to be, now you have real-time data capture of that, whereas previously you could have potentially had an error where the individual would have rerun the test a time or two until they got the information. So again, just being having that data integrity and being transparent and knowing if you have any events potentially that are within your workflow. Another instance, if you will, we can look
Mm,
at stability samples within a freezer farm, if you will, where you're monitoring. So you would have your internal monitoring systems if you're storing samples for your clients or even for yourself, and being able to, again, real time monitor your freezers, whether they're coming up for maintenance. If you have one that continually goes into alarm, again, you're going to have the folks on the ground that going in and doing the work, but the ability to capture that information and data and see it, if you will, real time is also very helpful for managing your manufacturing facilities and your storage facilities.
And quickly, where do you see and how do you see, if at all, blockchain being implemented in these types of remits? I know from a supply chain standpoint, there are certainly some exciting use cases
mhm,
to use blockchain
yep,
technology. And with the increasing usage of external manufacturing partners, and obviously we would hope that everyone's going to be entering their data correctly, etc. But the more systems and equipment that you have online that is linked to wider systems to track that data, do you see blockchain technology being leveraged in this kind of industry as well to really manage that from an objective standpoint?
I do. I look at blockchain as a way that there's transparency across the board, right? So
mm,
whether we're looking certainly from a medicinal standpoint of making sure that you're limiting the potential for counterfeiting of any of the product ultimately, or any of the materials going into the product, shall we say, upstream of the final product, but also getting
mhm,
back to that data integrity, right? So, with the opportunity for blockchain and the data to be, shall we say, collected, analyzed, and integrated, again, you're providing a stronger basis for proving and showing that you're compliant across the board, right? So, I
mm,
certainly do see it. You have many industries that are using blockchain, from the financial industries as well as others. I see it as a step, again, being able to share, teach, and understand within the pharma industry, but show how blockchain really does help to keep a stronger standard within the industry, within the manufacturing practices, within the supply chain, and the end-to-end process of making product and medicines. So yeah, I do see it coming along. Again, as you guys mentioned before, since it's not something necessarily that is common within the pharmaceutical industry per se, some other industries that may have adopted it much earlier on, such as the financial industry, banking industry, and such, it's going to be measured. It's going to take some time. It's going to be a balance. Again, I think that you will see it as we progress through the 21st century. And then at some point, I would argue it would almost be a necessity.
Yeah,
It certainly makes
for sure.
sense.
yep. I love that, Jamie. And to tie it all together, you've mentioned some really exciting speculative applications of these digital tools and mentalities and processes, some real world applications of them, and the importance of us, the humans, executing them. Can you talk about the importance and the actual convergence of those people, systems, and data as it pertains to Pharma 4.0 and digital transformation? I imagine there's going to be some complicated things to unpack and maybe even some perfect systems with imperfect users that may cause some issues for folks. So tear it apart, bring it all together for us. I just want to hear how you think of that.
Sure, absolutely, Phil. You're right that at the end we can have a beautifully automated system that, in theory, runs flawlessly, but at the end of the day, the hub, if you will, is still ultimately the people, right? We're a people-centric industry. You need people in all sorts of different roles to still make those decisions. Again, you can use artificial intelligence and machine learning for a lot of it, from the data analytics to how you're going to process and run your production. But at the end of the day, it's still people driven, right? You need the
Hmm. Hmm.
technicians, you
Yep.
need from end to end supply chain, whether you're moving those raw materials, whether you're binning them, whether you're making the product, whether you're doing the maintenance on the equipment, all the
Hmm.
way through the ultimate decision making of managing the equipment downtimes and the schedules to the production planning. Yes, a lot of that does have the opportunity to be regulated through artificial intelligence and machine
Hmm.
learning, but ultimately it's still people centric and you still need people involved every day. That's what makes the industry so wonderful, that you have throughout the manufacturing processes with some of these new digital transformation technologies. And again, that helps put up the guide rails, if you will. Whether you're using electronic batch
Hmm.
records, would help with certainly some of the potential for human error caused nonconformances.
Yep.
But at the end of the day, you're still going to, you can put, to your point, you can have a perfect, in theory, manufacturing process or end-to-end process. But just like biologics manufacturing, having people involved, you're still going to have a potential for some nonconformance, some error, because
Hmm.
we are people. We good, bad, or otherwise, we think on our own. Even as we're well read and well trained, sometimes data in equals data out, if you will, on some of these pieces of
Yes.
equipment. But at the end of the day, free will within people is gonna, they're gonna do what they end up doing. But I think it's a very interesting time, very fascinating time to be within this industry, and seeing how the data, the machinery, and the people all interface with one another, and how they continue to work together and grow. Again, I go back to the fact that it's the imagination of the people and the need
Hmm.
and the drive of the people that pushes this process forward, whether it has to do with automation, whether it has to do with coming up with different forms of immunotherapies or technologies to continue to
Hmm.
make these efficient manufacturing processes. At the end of the day, it's still the people, it's people driven. So
So
Yep.
key. And the biggest, one of the biggest challenges, if not persistently the biggest challenge in the industry, is
right.
finding the right people and retaining them, and having people who are
Hmm.
bought in on what you're
Hmm.
trying to achieve and who are patient centric, and understand that they're what they do on a day-to-day basis, the level of focus and quality and integrity that they put into their work really impacts the end product getting to patients who need it, right? And I think
Yep.
obviously,
Yep.
I think AI is turned into a bit of a buzzword over the past kind of 12, 24 months. Machine learning and artificial intelligence and all of the potential benefits that it's going to have globally across every potential area of industry and walk of life is so exciting. And I guess within our space, we've talked about a lot of the benefits from a manufacturing standpoint, from a preventative maintenance standpoint, from a data integrity standpoint, drug discovery as well. It's all contingent on data, and people do describe data as the new gold, right? The people who are going to do the best are companies who have got huge data sets of clean and accurate and high quality data, and then they can feed them into these huge machine learning models and really get some exciting results. How do you personally see digital transformation trends and the benefits evolving for specifically the pharma and biotech space over the next few years?
Sure. So thanks, Max. One of the things I was just thinking about as you were speaking there was Going back to the project management side of things, the opportunity to use project controls, systems, and programs such as NetPoint and A3 to really help for operational readiness as you're bringing facilities up, as you're bringing new technologies forward, processes forward. Being able to input the data on one side to know if you're going to meet your targeting goal, to have that facility ready, have that tech transfer completed, ultimately to get the medicine to the needed folks. I also again go back to where we talked about how that transformation happens across the entire industry. Again, the data capture, the staying with the compliance side of capturing that data, ensuring the integrity of that data, because that's going to be key, right? We capture all this data. We want to make sure that, shall we say, that it's clean data, it's honest data, it's data that is accurate, that we can use to make those decisions. Again, I get back to where we talked about the blockchain and making sure that it stays integral and not counterfeit, if you
Yeah.
will, that data is ultimately going to be used more and more through machine learning,
Mhm.
and then ultimately running it through artificial intelligence, if you will, to help drive decisions. Ultimately, people are going to be the ones speaking and making those decisions on how they enact the data that's been analyzed. But your big data analytics, your programs, those are going to be the pieces that are really going to help drive you into the decision making process of how you go. Do you continue on the same path you're on? Do you pivot to something different? And at this name of the game is being able to do that as quickly, however very robustly as possible, right? Having the most data, the most accurate data, and being able to digest it and analyze it and be able to action upon it once you have that. Use that to make that decision. Not too dissimilar from, for instance, a real world example, the artificial intelligence that you may have in your vehicle, right? If you've not moved to
Mm-hmm.
fully autonomous driving vehicles, of course, a lot of the newer vehicles have collision avoidance. It'll tell you if you're starting to slide from lane to lane, or that an object is in the road in front of you. The old switch for your high beams and low beams of your headlight, you can put the high beams on and it'll sense the vehicle out in front of you. So again, we're already starting to see this technology come into our daily lives a lot of times without even our like full recognition of it right
Yeah.
now. So it just makes sense that in our industry lives, it's also going to start coming in, and us being comfortable with it, willingness, open to change, but measured change, understand that we need to take it in a step by step process. The agencies understanding this and really driving it through their own initiatives and their expectations of what the different companies need to meet in terms of criteria, again, for data integrity, for compliance, for quality, your shareholders looking for the financial returns,
Yeah.
making sure that you're efficient and effective as possible. And then again, I go back to the ultimate patient wanting to and needing to have that medicine, whether it's through the clinical trials or the commercial product, a safe and efficacious product that gets to them in a timely manner. Whether it's due to an outbreak of a certain virus or bacteria, or whether it's again due to immunotherapy. So I think we really do owe it ultimately to our final end of the patient to look for new and cutting edge technologies throughout the process. That's really, at least in my mind, one of the reasons that I'm here and in this industry, is to ultimately help the patient with that product, with that medicine that they need. And if I can help them get it sooner, at a cost, and more efficiently made to them, that's ultimately
Mhm.
the goal.
Absolutely.
And Jamie, you talked about a noble end goal. The point of the entire life science industry is to help patients. But in reality, there are challenges here for companies that they face when they transition to these kind of either paperless systems, automated systems, unproven technologies, and they determine how much they're going to put onto the people in the systems and how they design the interplay between them. Could you talk a little bit about some of the issues and challenges, the obstacles, so to speak, that will come up, and then maybe how you overcome them pragmatically rather than just looking to the future and saying it will be better because technology, right?
Sure. I agree with you, Phil. Again, ultimately that is a noble goal or noble end goal. But there's a long road between here and there. And again, there's a lot of steps
Mm-hmm.
in between those. We have the point that, again, new technology is going to require folks that are willing and able, as well as to understand, to learn, agencies that are willing to accept that new technology, again, being in a measured and balanced state. Of course, there's the financial aspect of it, that moving from a
Mm-hmm.
paper based to a paperless system is not a snap of the fingers or a flick of the switch. Again, the point of our industry, and ultimately what the patient looks for, is that it's a tried and true method and process. So there's validation that has to come in, there's validation of equipment, there's validation of the process, there's the people aspect, which is, do you have the right staff? Do you need to augment staff, either by hiring new staff, training your current staff, or ultimately, if those two aren't currently available, bringing on additional staffing augmentation from consultancies that are able to do that, that are on the forefront, the cutting edge, that can come in with the virtual reality, so that maybe they can train your team, but your current team doesn't have that, or at least give them a background of what some of the new exciting technologies are coming forth. So again, also the willingness, again, we go back to the idea that even though we may have a perfect system, if so, or a perfect theoretical system, with people being involved and one's own free will, the idea of, are folks willing and open to accepting these new technologies, the digital transformation? And then there's some concern with that, of course, because
Mm.
it's scary, it's new, it's unknown. The B sci-fi movies of the 50s and 60s, where robots take over the earth, that may sit in
Yep.
somebody's head. Hey, am I going to am I going
Mm-hmm.
to lose my job because I'm being taken over by automation? You look at the auto industry, and that's a perfect example of how automation and people come in to play, as well as the pharmaceutical industry, but the auto industry, where they use giant robots to manufacture and build vehicles, and the people are working side by side with those robots, as the robots are doing the welding and the
Yeah.
painting and everything else. So again, it ends up ultimately being about the people's willingness and openness, and ultimately to the financial cost. Again, it's a
Yep.
business. What is the rate of return? We spend X millions of dollars now. Are we going to see that return in a year? Are we going to see it in 6 months? Is it going to be 5 years? So there are a lot of variables that go into play with that. But again, I think a measured and balanced path forward. And my experience within the industry has shown, especially the life science industry, is there's certainly a lot of stuff that's cutting edge, but again, a very good industry for working towards that noble goal of the patient in the end, but also doing it in a measured and balanced type. process, not a damn the torpedoes. We're going full bore into this. Like the old, did we all go with the Betamax or did we go with the VHS on the old VCRs
Yeah.
back in the day? Or did we go with the laser discs, the big
Good old
laser
laser
discs that
disc.
were about the
Yeah,
size
yep.
of the records? So again, just to throw some stuff in from the past, again, I think a measured and
Mm-hmm.
balanced approach, but using staying current within the industry, being part of the different working groups, being able to listen and work hand in hand with your regulatory bodies and agencies. And I think, again, it's a rising tide raises all boats or
Mm-hmm.
ships. The opportunities, you're going to have groups that are on the forefront, slightly further ahead than others, but ultimately, as you all work together, as we all work together, it's going to be a change that's coming, a rising tide that's coming. So being able to get on board, either staying within the pack, hopefully not falling behind within the pack, because then you're going to have to remediate and catch up to the level. So
Mm-hmm.
Definitely. There's a famous Japanese proverb that says the best time to plant a tree is 20 years ago. The second best time to plant a
that's
tree
correct.
is
Mm-hmm.
today. And I think it's
That's
a
right.
pretty relevant piece of insight there that a lot of these businesses, especially the bigger players that are very established and may not have an imminent need to invest in these technologies because they've got a lot of cash and they've got systems and processes and scale playing in to their advantage at this point. I think a lot of the newer businesses that are a bit more forward thinking and trying to be a bit more disruptive, who are going to adopt these technologies at the start of their organization, may present a bit of a threat to these larger organizations if they don't have the right mentality around this technology. And I guess, in your opinion, Jamie, what are the key factors that you see in terms of determining the success of the pharmaceutical companies' digitization and digital transformation journeys, and how can they best position themselves to ensure that they go through a smooth transition to a more digitized and paperless environment and reaping all of the benefits that we've gone through today?
Yeah, again, Max, I think you hit the nail on the head with the idea that you're new, you're smaller, you're more lean, cutting edge companies are going to be there. They do it out of necessity, right? Because they're smaller, they may not
Mm-hmm.
have the legacy systems in place, they may not have the capital, they may not have the labor available, but that's also what the definition of who they are is. They are cutting edge.
Mm-hmm.
There's a forefront, the trailblazers, and they're out there setting what that new standard is,
Mm,
blazing off the trail into the wilderness with some of this technology. And then some, of course, the larger organizations are certainly sitting there watching with good view of, is this going to be the next step? Is it a flash in the pan, if you will?
mm,
Will it
Mm-hmm.
ultimately drive the industry forward? And again, I think that's where we as an industry within the life sciences works hand in hand with our agencies and our regulators, because they're watching as well. They want ultimately to make sure that patient safety, efficacy with the medicines that are out there, and getting it to the patient, getting the medicine to the patient in a timely manner. So, are these new technologies viable, if you will? And what does it look like in terms of availability to for the implementation of that? The time, labor, and capital to be able to do that. Is it something that can be readily done? Is it something that you need a longer planning horizon, if you will? And then how do we pivot and move the industry forward with that? So again, I think you're always your smaller organizations cutting edge, if you will. They're the forefront, they're the leader on that. But the larger organizations within the industry are certainly interested any way to make their processes either more efficient or be able to be done in a timely manner, but also the regulatory requirements of being able to do that. So again, I think it's somewhat of a wait and see, but also a very done with a very keen interest on what's new, what's
Mm.
exciting. Again, ultimately, if you're the first or on the forefront of it, you can really step out ahead, whether it helps with the manufacturing process or getting that needed medicine out to the folks.
It's fascinating stuff. And I think when you look at the amount of capital, time, investment, facilities, etc., needed to get a drug from inception all the way through to commercialization, the scale needed previously and currently is still astronomical. And the number of different molecules that end up failing in the clinic and or before or after that is huge. And the amount of capital needed to get them to that stage is colossal. And I think
Mhm.
leveraging technologies like this, and as you said, these smaller businesses that are bringing new technology to market, they are leveraging these technologies out of necessity because there's no way for them to compete otherwise. But thinking and using these technologies at the start and then the inception of these businesses is actually creating some really exciting new technology that is coming to the market and new drugs that, from an identification standpoint, previously would have taken a decade to identify, that now with the right data, as we discussed, and with the right technology, you're able to identify in a far shorter time horizon and potentially in a far more efficient way. So I think it's a very exciting time to be in the industry. And I think all of these technologies that we've discussed are going to be net positive to the space. And it's going to be interesting to see which players decide to adopt them, which players decide to push aggressively into these new areas, and which players decide to sit back and just see what happens and what the landscape is going to change and look like over the next 2, 5, 10 years.
So, a quick piece on that is the adaption of technology, right? Again, just anecdotally, we have an experience of where Kodak was one of the first companies to come up with the digital camera, and they basically shelved it. I'm keeping it short on that, but the reality is, do we hear about Kodak? Do we hear about film these days at all?
No.
So again, with a
Mm.
digital camera, right? That was a competing interest to Kodak's main business, if you will, of film, and they were the ones who created the digital, or one of the ones that created an early digital camera. And because you go back, and I like being an individual, a student of business study, and you look at that, and
Mm.
that's a perfect example.
Yeah.
Totally off topic, but the adaptation and willingness to change. And in that case, they could have changed, they could have stayed at the forefront. They chose, due to their industry and market, that they were going to go otherwise. And we have these digital cameras on our phones and everything else, and unless you're into it as a hobby, there's
No.
very little print film done anymore. So again, it's and then we could probably spend 45 minutes to an hour on all sorts of different industries that talks about the ability of adaptation and change and willingness, and saying either we're titans within our own industry and we basically are the industry, to the next day,
Mm.
maybe not a 180-degree pivot, but a 90-degree pivot.
Yeah.
And now we're now, not again, not for this per se, but the town that I grew up in was known for their steel making in Bethlehem,
Hmm.
Bethlehem Steel.
Mhm.
And I watched, very much a very large employer within the town go to parking lots that were not holding cars anymore 24/7, but growing weeds in them, to
Mm.
steel plant that's now a casino. So the ultimate not willing to adapt and change certainly does have an impact, to the point where certain points where that company was literally being able to just print money for all the steel that they were providing for the infrastructure within the US, for supporting the
Mm.
overall the naval integrity of the
Mm.
US, with the battleships, the guns that went on the plate armor, you name it, to literally it's not even there anymore.
Yeah.
It may be a street name, there may be blast furnaces, but again, you can use Kodak, you can use the steel industry. So there's numbers of items, more of a sidebar than our actual conversation. But I grew up in a time where the plant was shutting down. So to see the transition out of, or what could have been, I see that life science is certainly more on the willingness to stay on the cutting edge and adaptation to future and technologies than some of the other industries were.
You need to. Disruptive
Yeah.
technology is always going to come
Mhm.
around, and as you said, if it's adapt or die, and if you don't adapt, and I think you use some great examples there, and there are several other interesting things going on at the moment in other industries. The auto industry, you mentioned that earlier with the
Oh,
adoption of
absolutely.
EVs. I could go on for 3 hours about that. It's fascinating to see what happens, and again, who's going to be around. But from our industry perspective, I think, yeah, those who are going to be aggressive but measured, as you mentioned, around adopting these technologies
Mhm.
are the ones
Mhm.
who are going to win and be able to get the best product to the patients in the most cost effective, high quality, and low risk way possible, which is ultimately the end goal.
And I think maybe to wrap it here, Jamie, I think of the paper industry in Massachusetts where there were mills all the way up and down through Lowell. That is no longer a thing. And then I also look to my childhood and watching Terminator with Skynet running the planet. And that was not a measured implementation of AI. So if we can end up between paper and steel and then Terminator, I think we're in a good place within the industry. So measured application and adoption at a reasonable rate seems good. Small companies are leading the nimble sort of bleeding edge stuff, with larger companies waiting to take on the right pieces through acquisition or through copying those systems in some type of way. It's very exciting. It's cool stuff. Jamie, thank you so much for running through all of this. I don't think we have anything else on our end. Max, if you have anything to close it, go ahead. But I think this has been amazing, and I'm excited for this to be the first time we're able to do the GX podcast.
Absolutely. Nothing to add on my end. It's been an absolute pleasure. Thank you for your insights and your thoughts. I think there's a lot to take away from this, and obviously it's certainly something that people need to be aware of. And the more education that can get out there to individuals at companies to try and drive these efforts and say, hey, to their manager, what are we doing about this? How are we looking at this? And having those forward thinkers, people who are going to push these things into the forefront of their organization, is a powerful thing. In addition to any leaders out there who are watching this and are thinking, hey, maybe we need to start moving towards this and get these efficiencies
Yeah.
that are out there. I think it's a great discussion topic, and really appreciate your insights.
I would agree. Thank you very much, gentlemen, for having me. Very exciting and very happy to talk on the subject for sure. I'll certainly look forward to what the future holds.
Absolutely. Thanks again, everyone. Have a wonderful rest of your week. And this has been episode 1 of the i-Pharm GX podcast. Thanks for listening.
Take care.
We hope you enjoyed this episode of the GX podcast. Please join the discussion on our LinkedIn page, and we invite you to reach out with any questions, topics, or recommendations for future guests.